Moderate and vigorous intensity physical activities are known to reduce the risk of mortality, whereas air pollution, such as particulate matter, increase the risk of mortality. However, moderate or vigorous intensity physical activities may be associated with increased inhalation of air pollutants, and the combined net benefit or harm is unclear. Hello, my name is Hanjin Park, and I'm a clinical fellow in Division of Cardiology, Yonsei University, College of Medicine, South Korea. I am here to tell you about the original research article that will be published in Mayo Clinic Proceedings entitled The Association Between Physical Activity Intensity and Particulate Matter and Alcohol's Mortality in Older Adults. In this study, we examined whether the health benefits of vigorous or moderate intensity physical activities are attenuated by potentially harmful effects of paradoxically increased inhalation of air pollutants among older adults who are particularly vulnerable to air pollutants. A total of approximately 81,000 older adults were included from the National Health Insurance Database of South Korea. Physical activity was assessed by International Physical Activity Questionnaire that assessed the frequency and amount for light, moderate, or vigorous intensity physical activities. In addition, particulate matter 10 micrometers in diameter was assessed using a national atmospheric monitoring site, and a cutoff of 90th percentile was used to define high and low to moderate air polluted areas. We found that both moderate and vigorous intensity physical activity was associated with delayed mortality in low to moderate air polluted areas, with vigorous intensity activities providing additional benefit. In contrast, moderate intensity physical activity was associated with delayed mortality, whereas vigorous intensity physical activity was associated with hastened mortality in high air polluted areas. These findings emphasize on the importance of continued engagement in moderate intensity physical activity, even in high air polluted areas, for longevity. However, given that vigorous intensity physical activities may be associated with negative health impacts in highly air polluted areas, these findings also emphasize that searching for local levels of air pollution, and that when the air pollution is high, indoor vigorous intensity physical activities or with strict self-protection such as using facial masks represents a potentially safer alternative. In addition, these findings also emphasize on continued efforts to improve air quality for unrestricted participation in physical activity. Thank you for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.